Welcome. Another video series in our zoology introduction, talking about basic anatomy today. So before we can study our first animals, we need to establish some basic anatomy terms. We'll be using some commonly established terms for planes and directions that will help a lot when we're going through our procedures, and also when comparing one animal group with another. So when you're done with this lesson, you should be able to identify and reference the anatomical planes and anatomical directions. Our three main anatomical planes are the frontal, the sagittal, and transverse planes. So these are going to be those imaginary lines running through an animal. We'll be using those three terms. One thing that can sometimes add some confusion is that not all textbooks and teachers use the same terms. I'll introduce you to those alternate names, but then afterwards we'll use the names that are presented here. Oh, and here's just a labeled view of those three anatomical planes. So we've got our, well, I'll highlight those on the next few slides. All right, so we've got the coronal plane, sometimes called the coronal plane, what we will be calling the frontal plane. That's going to be kind of going along the side and dividing the animal into the front, or what we really will call the belly side, or ventral side, you'll later find out, and the back side. So this plane will divide it into kind of a front half or belly half and a back half. Next is the sagittal plane. This is going to divide the body into right and left parts. Strictly speaking, a sagittal plane does not have to run right through the middle. It can be slightly to the left or to the right. When it does run through the middle and divides the body into equal left and right halves, it's actually called the mid-sagittal. But generally, for our purposes, from talking about the sagittal, we'll kind of be talking about a mid-sagittal plane. And finally is going to be the transverse plane. This plane will divide the body kind of in the top and bottom half, or top and bottom parts. It's going to be perpendicular to the coronal and sagittal plane. In reference to humans and maybe some other mammals, we'd say that it's kind of cutting along the waistline. Keep in mind, though, that not all animals have a waist. And also, just like the sagittal plane, the transverse does not necessarily have to go right into equal top and bottom parts. All right, and now for some directional terms that we're going to be using, some basic directional terms that you should know. I've listed them here. I'll kind of zip through them quickly, but really I recommend checking out the Quizlet set with the terms and definitions that I've created for you. I've probably already mentioned this in class before, but there's going to be a lot of terms to know for a class like zoology, and Quizlet is really a great tool for helping you learn key terms. All right, so those key terms are anterior, which is just simply the front or head end, coming from the Latin ante, meaning before. Posterior, also the kind of referring to the rear or tail end, from the Latin post, meaning after, like post game. Dorsal is going to be the backside. Fishermen or ladies probably already know, fisher ladies would know this term, talking about the dorsal fins on the back of a fish. Ventral is going to be the belly or underside. Proximal is going to be a point at which an appendage joins the body. So, for example, if you're going to look at an appendage like your arm, the armpit area would be proximal. The opposite of that would be distal. distal is going to be the outward end of an appendage, kind of away from the body. So kind of an example, again, on the arm would be fingertips would be more distal, whereas the armpit would be more proximal. And then last couple terms here, lateral, meaning along the sides. Like in football, there's a lateral throw towards the side. And last term here is medial, meaning the middle. All right, that's going to do it for our lesson on basic anatomy. Now you should be able to identify and reference the anatomical planes and those directions. As always, if you still have questions, please see me or check out some of our other resources.